Blue Mountain Psychiatry is the premier psychiatric practice in the greater Lehigh Valley area. We address patients who have severe mental illness, and we've been working on treating refractory depression and anxiety and bipolar disorder and post-traumatic stress disorder. We work with our patients to treat their psychiatric disorders with a multidisciplinary approach. We do psychotherapy, medication management, we offer them transcranial magnetic stimulation, and we also offer them ketamine infusion to treat the most refractory cases. Ketamine is a medication that was approved in the 60s and 70s for anesthesia. It is a very safe anesthetic because it does not cause suppression of the breathing. In the beginning of the 2000s, when I was at the National Institute of Mental Health, myself and a group of other researchers tested the hypothesis whether ketamine can help patients who had refractory depression and suicidal thoughts. And in a small test paper that was published in 2006, we proved that ketamine could help patients with suicidal ideation and depression symptoms. Later on, after several years, there was a widespread adoption of the use of ketamine infusions for patients with refractory symptoms of depression and suicidal ideation. Ketamine infusion is reserved to patients with severe depressive symptoms. What we do is we measure their depressive symptoms through our measurement scales, such as the Beck Depression Index or the Patient Health Questionnaire or the MADRS questionnaire. And those in the severe range are usually eligible for ketamine infusions. We subsequently do an extensive informed consent process and a medical workup and offer them infusion through an intravenous catheter of ketamine for 45 minutes. The patient is safe in our office, and I am in the office monitoring the infusion. We usually administer 3 infusions a week, and the course consists of about 6 to 12 treatments. Patients could start seeing results within the second or third infusion. We have seen over the last few years that we are able to scratch the surface and be able to more aggressively treat psychiatric illness. For the first 40 to 50 years in the field of psychiatry, we are able to aggressively identify refractory disease, go after it with interventions that can help patients. And we're able to identify who are the patients who are going to be refractory and administer those treatments early for them. We're also able to do genomic testing to identify who are the patients that are not going to be responding to medications and will need more aggressive treatments. So we're hoping that in the next few years, we're also going to be able to identify new classes of medications based on our success with ketamine that addresses other neurotransmitters in the brain. This is a great and wonderful time in the field of psychiatry. We are on the cutting edge of new treatment approaches, and I'm hoping that in the next 10 to 15 years, we're going to have new classes of medications that help patients. You know, depression is the #1 cause of disability in the world, and by addressing aggressive treatment for depression, we can help our patients recover and lead a normal, functional life.